Morning, everyone, and welcome back, as she mentioned, to our fifth session. We, as you know, we are discussing around methods of economic evaluation. And last day, just a recap that we did cost intervention, because if you remember that for any economic evaluation, I think you understood that the cost is the major component in all economic evaluation. So if it is a partial one or if it is a full one, you have to do a cost analysis. So we talked about an intervention last day, which was I gave the example of intensified mission Indradhanush, because I thought I will continue with that example, so that you will also get a sense of like what are the outcomes of those when we did the cost effectiveness of that. So if you all remember that I spoke about like cost analysis, cost effectiveness, cost benefit analysis, and difference between all those. I hope you still remember those. But just to recap that when we think about any costing of any intervention, whatever it is, like as I mentioned, that think about any intervention. I gave an example, but does not necessarily mean that you have to only think about this. Think about any intervention you are involved with, and try to think like if you want to do a cost analysis initially to start with, what are the requirements, what are the things that you should be knowing before you go for that analysis. So I have mentioned that we need to first think about like whether we are going to do an incremental versus a full cost analysis, financial versus an economic cost analysis. Just to recap, tell me, what is economic cost? Like what are added when we consider economic cost? Just to see how many of you remember what is the economic cost of doing and cost analysis. Like what are added? Please add in the chat what will be there in economic cost analysis versus financial cost. What are the components we generally consider in an economic cost analysis? Anyone in the chat, please? No response. I am saying that economic cost analysis, when we do, you remember I said financial versus economic cost. Financial is the actual money spent. Financial, whatever you are saying, vaccines, transport, these are financial cost. These are actual money spent. But what extra we will do when we go for an economic costing? Yes. So okay, so you were mixing a little bit when you say we consider time, productivity loss. Recurring expenditure is again financial. It's all about money. But time cost, productivity loss. But here there is a mixing. Life saved. That's an outcome. That's not really, I mean, you can do a cost of that, but it was very simple, life saved. Whether you are going to consider that or not, that's a different story. What I'm trying to ask you is, if I do a financial cost analysis, I will only consider the expenses, that is the actual money spent. We will not consider anything else. But when we consider economic cost, it will be the time cost, basically, because the time cost, like the volunteer time or person's time spent, which is what I called is opportunity cost. If you remember the term opportunity cost, or the donated items, those, if you want to add into the analysis, then it becomes economic cost. Now, the productivity loss, here the problem happened is that there is so I don't need any other answer. So basically what I'm trying to say here again is the mixing is that time cost is from a perspective, productivity cost is from a different perspective. Okay. So generally, if you have to be careful, if you are thinking of the costing from a societal perspective, then it's fine. So the next important point we spoke about is the perspective of your analysis. And when you say time and productivity, it means that you are considering societal. You are taking patient, you are taking provider, because you are considering everything. So that's good, but that's the perspective, right? The next important thing. And then for an intervention analysis, so these are the basic things you need to understand: type of cost, perspective, level of the analysis, like at which level you want to do the analysis. And then finally, someone of you asked last day whether it is an activity-based costing. Yes, generally, any intervention is called an ingredient-based or an activity-based costing. What does it mean? Meaning that we identify each and every ingredient, meaning the component of the whole program, like the intervention. I'm not saying whole program, don't get confused. I am saying the intervention. Here, if you remember the example I gave last day, it was intensified mission Indradhanush, and we identified each and every cost line items and then activities. So basically, that's why it's called activity-based costing, because we have to identify the activities of an intervention and then have to find out the cost items and then do the costing. So that's the cost of the intervention. Then let's go to today's topic, which is the outcome. So we talked about this cost. Now I'm going back to this example, which I was talking about, to tell you how it looks like. If you remember this figure before, in place of BART cohort, what we wrote was target population. So for any intervention, you have to have a target population, right? In intensified mission Indradhanush, our target population was our BART cohort. Okay, so I put, in place of target population, I put BART cohort. If you remember again that graph, here it was in place of IMI, which is intensified mission Indradhanush, the example I'm giving, it was intervention versus no intervention, right? So we were basically in a cost effectiveness analysis, we compare, I told you that there has to be a comparator, right? So here the comparator is no IMI. So it means that what will happen if the routine thing goes on, and then what will happen if a new program like IMI comes in. So in your case, whatever intervention you are thinking about, when you think of an economic evaluation, which is a cost effectiveness analysis, cost benefit, whatever you want to think of, you have to think, what is my intervention? And then what is the counterfactual? What is the comparator? If the intervention was not there, then what? In our example again, so as I said, there is a routine program going on. And then this IMI was an addition. So then it means that there will be a cost for the routine program, and therefore it would be a cost for IMI, which I discussed the other day. That is the cost of the intervention. So, and that's why it is incremental, because see, cost of RI and cost of RI is common in both. So you really don't need to cost it, right? Because you know that this is actually canceling. If you remember the simple thing in the mathematics, that we cancel this out, right? Because cost of RI is known. I am expecting that the counterfactual is known. So that means that you have to cost only the IMI, which is the incremental. That's why I spoke that day that it's not the routine cost. It's the over and above whatever we did, right? So that's the cost of IMI, because it's the cost of RI plus IMI in case of IMI, and when there is no intervention, is only the counterfactual cost. Similar is the outcome. Now we are coming to the outcome section today, which is the consequences. What would happen if there was only a RI? That we know, that is without IMI, we already know the consequences of RI. And what is addition is the consequences of IMI. what happened if when IMI happened, what are the changes happened? That's the incremental changes. So basically what is this now? Is the incremental cost versus the incremental benefit, isn't it? So this is how we look at. Now let's look at what are the consequences or the outcomes of IMI in our study we considered. It is our study. So in your study, you have to think like, what are the outcomes which we are looking at, what the intervention is going to aim. That's the outcome, right? Now this outcome can be intermediate outcome, that can be a long-term outcome. It's up to you which outcome you want to measure. So that's a decision you have to take in your economic evaluation, whether you are happy to be within the intermediate, like a short-term thing. And if, like here, see the example here again, vaccination doses delivered. This is the short time thing, right? IMI happened, additional vaccine doses were given, and we found that data, and that's our one of the output. Okay, this is short term. But if you think of the longer term one, see, years of life saved. So years of life saved meaning for giving a vaccine, we are assuming that we saved this many years of life of a child. Or disability adjusted life years, which I'm going to introduce today to you, DALYs. I'm sure you have heard a lot about it, but let's talk about it today. What is DALY? So basically, if you are thinking of looking at the broader perspective or broader outcome, then you may think of, like, suppose if you do not vaccinate the child with say polio vaccine, what will happen that there is a chance of the child to affected by the virus, and then the child may be paralyzed at some age of the child, right? It may happen. So if that happens, then the child will live with some disability, right? So you are going in a longer term outcome. So again, it's up to you whether you are deciding to be short term or you are going for a longer term one. We can, and as I said, this vaccination, let's move. So we are now in the outcome, and now the question is measuring versus valuing. Why this question comes? Because measuring meaning just measure. And see, vaccine doses delivered, you can easily measure, right? When you are doing the intervention, you can easily see how many extra doses were delivered. Zero dose children lived. Zero dose children meaning the children who did not receive any vaccine before and got the first vaccine in IMI. We call them zero dose. The children who did not get any vaccine. So how many of those kind of children reached by the program, by the intervention I am talking about? These are easily measurable outcomes, isn't it? But think about the DALY, which I said is whether the child will be living with a disability or not. So basically, it's a time constant, time issue. Like we are thinking of a long-term outcome of vaccinating a child with polio today, right? If you are thinking about this long-term outcome like DALY, then you have to value health. It's not very simple that you get 1,000 doses delivered. It's not that. You have to calculate, you have to value the life of the child, right? So it's up to you whether you are going for a long term or short term. If you are going for a long term, you have to value these things based on your intervention. Whatever you can, like, say, for example, you are doing a mental illness intervention. So that intervention, if you can reduce the number of cases of like depression or something, it will have a value in future, right? the person with depression and the person without depression will have a different value of their life, right? Living with depression and living without depression is not the same. And you are going to value that. So that's where the concept of DALY, QALY, etc. comes in. So as I said, DALY combines two things. One, whether the life is lost completely, whether the child died from polio, that's one thing. And the second thing is whether the child is living with paralysis because of polio. That's the disability part. So DALY combines two things. One is the mortality, second is the morbidity. And it's a time factor. Because how long? Because the child, suppose, got polio at the age of 10. The child is supposed to live up to the life expectancy of that country, right? Average life expectancy, which is say 70 years of in a country. So that if the child has a paralysis because of polio at the age of 10, and the child was supposed to live up to 70, that means 60 years of the life of the child is with morbidity. So then we have to value this. Like, how much do we put value for this morbid life condition of 60 years of the child? Okay, so that's the DALY. And if a child dies at age 10 because of polio, that is another thing. That means that the child lost 60 years of the child's life because of polio. That's how the DALY is calculated. So one DALY means one healthy life year lost. So whenever we say DALY, this means one healthy life year. So, and that life year, if it is lost, is we say that one DALY lost. Okay. So let's talk more about, I hope you understood that DALY basically is the combination of morbidity and mortality. Here is the formula for DALY. Okay, DALY is equal to YLL and YLD. This YLL is the years of life lost due to premature mortality. I gave the example. The child died at the age 10 because of polio. That means years of life lost due to premature mortality is 60 years if the life expectancy of that country, average life, right? Every country has a life expectancy table. So from that table, you got like at the age of 10, if the life expectancy is another 60 years, so that 60 years is lost because of the premature mortality. And then YLD, years lived with disability due to the disease morbidity. This is what I said. Now, the formula, this is very simple. The formula is YLL, that is the premature mortality, because I give the example of one child, but you have in your program, you have number of people, right? Say, for example, in our example, it was the whole BART cohort. So if I want to calculate the DALY, we actually have to figure out how many deaths at what age we prevented because of vaccinating the child. And there are many vaccines. So our case was very complicated because we had to figure out every single disease which can be prevented by the vaccine. Forget about that. Think about your program. You have a target population where you are doing the intervention. The intervention may help reducing few mortality, premature mortality. If that is the case, then how many number of deaths that can be averted, that is what you need to figure out, or how many deaths actually happened even after the intervention, or if with the disease, whatever it is. So when you are calculating the DALY, your YLL is the formula which is N multiplied by L, where N is the number of deaths and L is the standardized life expectancy at the age of death. This is what I'm trying to say, that at the age of 10, my life expectancy was 70. So I am losing 60 years, okay? And then YLD is the number of cases, like number of polio cases in my example. And DW is the disability weight. So here lies the issue, like what is disability weight? Because see, if a person in a condition, say for example with depression, and the person with a terminal cancer, I hope you are assuming that these two will not have same weight, right? A person maybe will not probably rate it in the same way like a depression or versus a terminal cancer, right? So that means that disability weight is based on the critical condition of the disease or condition. This disability weight has been developed by the disease burden global. I'm sure you all have heard about the global burden of disease studies, right? So this group, the global burden of disease studies group, they have come up with these disability weights. So we really don't need to bother much like how will we get this disability weight. These are available. So disability weights are available for 2004, 2010, and recent one I got is 2017. So for many conditions, many disease conditions, it may not be exactly the same what you are looking at, but you will find something very similar and put that disability weight in your calculation. That's how it should be. I am showing you an example of the global burden of diseases 2017. This is because I got the Excel. So I am putting this way only. So if you see, HIV/AIDS, tuberculosis without anemia. So case is like tuberculosis with HIV infected. They're saying that the disability weight is 0.408. One thing you see here, you note here is the higher the disability weight, meaning it is going towards the worst state condition, right? So if it is 0.999, that means that it's almost like a death situation. So 0 here in case of DALY, 0 meaning good, and 1, it means towards 1, it means it's very severe condition. You see that TB with HIV is getting a score of 0.408, while a chronic kidney disease untreated, like a terminal phase, it is getting 569. That means it is expected that the terminal chronic kidney disease has a higher disability than as compared to TB with HIV. Okay, HIV with treatment, huh? It's not like without treatment. So this is how you will get all the different conditions. As I said, there are many conditions where you will find the disability weights. And and another thing I wanted to mention is if you don't find your disability weight, like the conditions disability weight in 1 year, like you are not finding in 2017, because actually when I was looking at this, I found that there are many things which are missing in 2017 list, but don't worry, you can go to 2010 list, you will find somewhere, okay? Though I would say that there were a lot of discussions around using these disability weights, because many researchers and clinicians, they do not agree with some of these disability weights. They feel like these are not really making sense to them, because how come this is, in some cases, it said that how come it is lower than this one? They felt that it should be higher. But this is how the global burden of disease group came up. And this is what the researchers across the globe use it. Unless there is a country-specific list. So basically what I'm trying to say is this is the list which you have to use for disability weight. And you can get your rates from here. Now I want to give you an exercise. I hope you understood. Remember this. Note this down. If I'm giving you a few minutes, because the exercise is to calculate the DALY. So you have to understand what is DALY again. If there is any confusion, please write in the chat. DALY is the summation of years of life lost and years of life lived in disability. The formula is YLL, where N is the number of deaths, L is the life expectancy. YLD is the number of prevalent cases, number of cases in that condition, and disability weight multiplied by disability weight. Write it down so that we can do the exercise quickly. Okay, if not, I will come back again, but this is the exercise. Suppose out of 1 million people, 100 got TB at the age of 20. Please read this very carefully. 100 got TB at the age of 20. 10 die of TB right away, okay? 90 survive, but they are sick for 1 year. Disability weight for TB is 0.408. I showed you. This is I took from here, 0.408. There is a range also. You can do a sensitivity analysis using the range if you want, but generally 0.408. This is what I took. And suppose without TB, the life expectancy, those who died would have lived up to 70 years. Okay. My question is, how many DALYs were lost? To answer this question, you have to find out this. That's why I gave you the clue. How many deaths were there? What is the YLL? That is years of life lost because of death. What was YLD? What is the years of life lost because of disability? And then DALYs. So my final answer I want is how many DALYs were lost, but then you have to calculate for deaths, YLL, YLD, and then DALY. Let me know. This is the exercise. Do it very quickly. This is how you have to calculate your DALY. And I will give you 5 minutes for doing this, though it should not take 5 minutes. That's too long. But yeah. Please feel free to put in chat if you have any question, any clarification, anything. Think about it very carefully. 10 people with TB at the age of 20. 10 died. 90 survived. Sure. 90 survived, but with some disability. and the weight is 408. And those who have lived, those who have not died, they would have lived up to 70 years. And this is the formula in 5 minutes. So I will ask you at 10:08 or something, 10:07 or 10:08 maximum. Yeah, that's too long actually.
We've added the formula in the chat box also.
Oh, okay. That's great. Yeah. Here are the questions, like how many, final answer is how many DALYs were lost, but that's YLD DALYs. Why it is taking so long? How many deaths were there? You can write it from here, right? How many years were lost for death? So you know the number of deaths. You know that how many years the people were supposed to live if they were not died by TB, died from TB. So you know that, right? So that's the years of life lost. And then those who survived, you know the number of how many people survived, and they survived for 1 year, like they were sick for 1 year. And how many deaths were there? Deaths were 10, right? How many years were supposed to live? So 10 people died. Simple. Deaths were 10. How many years those people were supposed to live? Suppose 1%. Think of 1%. If the person was not died, how many years the person was supposed to live? Yes, but then at the person was supposed to live up to 70, but at which age the person had TB? No, at what age the person had TB? 20, right? So then how many years I am supposed to live? Suppose I'm 20 years now and my life expectancy is 70 years. So how many extra years I'm supposed to live if I don't suffer from TB? 50 years. That's right. So I have TB at the age of 20. I was supposed to live up to 70 years, but I die. If I die, that means I'm losing 50 years of my life, right? So 50 years of life were lost by how many people? 10 people, right? Yeah, so multiply 10 into 50. How many YL? Huh? How come you got 1020? Yes, YLL is 50 multiplied by 10. Got it? How many? I hope everyone got it. Yes. So basically, at what age the person suffered from TB? I think the confusion happened there. At what age the person started having the disease is 20. From that age, if the person was not having TB, he or she was supposed to live up to 70 years. But at the age 20, the person already, 10 of them died. So 10 of them lost their life for how many years? It's 50 years, right? The next 50 years, he or she was supposed to live, but they died because of TB. So the life years lost was 50 multiplied by 10 because 10 were the people. Then YLD. How many people survived in this state? How many people have the disease? Answer me in the chat. How many people were there in the disease condition? No, 10 died. 100 were there, but 10 died. So how many of them were, yeah. So basically YLD is for them who survived, right? If the person died, that means years of life lost. But YLD comes only when someone is surviving. Otherwise, how will they have a disability? Disability meaning they're surviving. So how many survived? 90 survived. So 90, and then what is the disability weight? No. What is the disability weight? Because 90 survived with disability. So 90, the formula was prevalence multiplied by disability weight. What is the prevalence here? What is the prevalence here? I want to know what is the prevalence. Why are you saying 90 by so many? 90 is the prevalence, because 100, there is a million, that's right. But 90 is the prevalent, meaning the 90 is the people for whom I have to calculate the DALY. Sorry, YLD. So 90 is the prevalence here. And then I have the disability weight of 408, right? So yes, that's the right answer. So now what is DALY? What is DALY? DALY is, okay, I went to because I have not much time, so I went to my answer. Okay, see here, 10 is the death. 50 years into 10 people is 500 life years lost. YLD is 90 people multiplied by 408, 36.72 years of YLD. DALY is lost, YLL plus YLD, 536.72. Is this clear now? How you calculate DALY? This is how you have to calculate DALY for if you want to go for a economic evaluation with cost effectiveness with DALY as one of your outcome measure. But I hope you understood that this is a time factor, because we are looking at how many years they will go for disability, how many years of life lost. So that's a time bound thing where we are talking about the the outcome. Okay, I hope it is clear. If not, please feel free to put it in the chat. If it is not clear, this is the formula, how we have to do it. Very simple, but meaning the example was simple. But I think normally it is not very difficult. Now coming to another concept, which is QALY. I'm sure you heard about it. How do you interpret? Okay, interpretation is 536 DALYs were lost because someone. Yeah, but the number of cases in your, I understand, prevalence is out of something. That's why I started with the million number. That's true. But here, when you are, as I said, you are not considering for everyone, right? You have a cohort where you are doing the intervention, right? Within that cohort, I had though million, but I had 100 who had TB, right? So these 100, out of these 100, I calculated all these things. Like you will have to have a target population for your intervention, right? So then how many people are in that state, disease state, who will have the disability? This is how you interpret this. And interpretation of the result is that 500 years were lost. Let me show you, go back, show you. Sorry. 500 life years were lost because of TB of my population. Whatever was my population, 500 years were lost. So we will also have a disease condition in your case. And so you will find out that without the intervention, how many lives were supposed to be lost? And with your intervention, how many lives were lost? There will be a difference, right? Because you did the intervention, you are hoping that lesser number of lives will be lost. So that's how it will be interpreted. If you remember the first few slides where I showed you here, consequences, you will have both. Like you will have one without, you will have one with. So you will interpret like without this intervention, this many lives were supposed to lose. Then this many supposed to lose if we have the intervention, then minus. And then actually we minus at the DALY level. We don't do at the years of life lost level. Because if we go for DALY, that means we are YLD, like the morbidity also needs to be considered. So that is your final interpretation is that with my intervention, 536.72 DALYs were lost. Previously, suppose without the intervention, 1,000 DALYs were lost. So incremental DALYs, which you can, DALYs were averted, like those are lost. So you want to avert. How many you could avert? If the previous one, like without intervention, if it was 1,000 and now it is 536, so 1,000 minus 536 were averted. DALYs were averted because you could have avert the mortality, morbidity with your intervention. Did you get my point? Did you get the interpretation okay? No. 500 years lost for the 10 people who died. Right? The survivor, how come the survivor will have a death? So survivor will have a disability. And the death will be those people who actually died. So you will be actually, because you see the DALY formula, it is YLL plus YLD. So you are considering both. You are considering first death. How many deaths you could have averted because of your intervention? That's first. And second thing is those who survived, those people may have some disability, will have actually, in any condition, you will have, like the survived people will have some kind of disability. It could be very less disability, it could be very high disability, depending on the condition. So you have two things. One is died, so life years lost. Second one is life lived with disability. And the DALY is the sum of those, both. Now, your interpretation is that without the intervention, there were 1,000 DALY. With the intervention, I found 536 DALY. This means my intervention were able to avert 1,000 minus 536 DALYs. That's the conclusion. Okay. Let's go to the next idea is QALY. QALY is actually the opposite of DALY, okay? Very simple. If you think of simple term, it's the opposite of DALY. Quality adjusted life years. See, here the quality comes in. So basically, we want to gain this, like we want to gain quality adjusted life years. So QALY is gained DALYs are averted because DALYs are bad things, right? I initially said one DALY meaning one healthy life year lost. So we don't want the DALY. So DALY we want to avert, and QALY we want to gain because it's quality adjusted life year. Now, again, the same thing. It talks about the life. It talks about the health related quality of life. Like in Delhi, we talked about the disability weight, like how bad is the situation for me to live with this disease state. Here, we'll talk about how I'm rating my quality of life with this condition. So that's the interpretation is little different, but it's the same thing. Okay. So and as I said, it is opposite. Here, one meaning perfect health, but if you remember the disability weight, the higher the disability weight, it means closer to death, right? That's how it is different, because QALY 0 is dead, 1 is perfect health. So I really want to go towards 1 because my quality adjusted life years will be very nice then. So how are we going to interpret? Suppose without a program, if you look at the graph, without a program figure, it is taken from Domand, who is the best, probably the most read book in economic evaluation. So without a program, suppose a person is, this is the duration of the life of the person, okay? The person without any intervention, the person was supposed to die here in death 1. But I introduced some program. And now, see, in every state of the life, that there is an extension. Previously, the person, if you look at my arrow, the person was up to this state without the program. Now, the person is up to here. So, better quality of life. So, like this, death, previously it was happening at the age or at death 1. Now it is happening at death 2. That means my program is able to do better quality of life for the people. And this shaded area, A and B, is like you have more years when you are living, and then you have better quality of life. So this is what QALY actually takes into account. So it takes into account the quality of life and death. As I said, it's very similar to DALY, but the opposite thing. Just the indicators are opposite. One thing you have to remember, if you consider QALY as your output of your economic evaluation, generally, tendency is that it called cost utility analysis. We generally don't call cost effectiveness. There is no difference. You can always say that I did a cost effectiveness analysis with QALY as my outcome measure. You can easily say that. But there is a tendency, because, you know why? Because in economics, we know, we call it like quality utility is the satisfaction of my life. As we consider this utility, like how I am considering the quality of my life in this calculation, that's why it's called cost utility analysis. Okay, so just the is the terminology, huh? If you use QALY as your outcome measure, you may want to call it cost utility analysis in place of cost effectiveness analysis. But if you say cost effectiveness, there is no problem. Now, I mentioned this, that QALY is just opposite of DALY, and QALY I want to gain because QALY is the good thing. I want to gain. DALY I want to avert. Okay, so these are basically things. Now, the question comes, how do I calculate QALY? Because I calculated DALY. Now, how can I calculate QALY? Because here I will live in a state where I have to rank, or I have to say how I am ranking my quality of life in that state, right? So there are different ways of doing it. Let me straight away go to this, because there are direct method and some indirect method. In the direct method, suppose this is what is called is visual analog scale. This is, as you can see, is a scale where 0, because it's QALY, 0 means worst imaginable, like it's kind of death. And 100 is the best situation, okay? Now, you are putting this scale to your study participants with a health condition. And you ask them, like, where do you want to put your health today in this scale, where 0 is the worst possible scenario, 100 is the best possible scenario. This is a direct method, right? You are asking them directly to rate where they put their value for their health. So that's a simple, straightforward tool. But honestly speaking, I use this for my study participants with TB, and I found it difficult to implement because not all understand this scale. They really did not get, like, what do I mean that how is your health today in this scale? Because they really, many of them did not really get what this scale means, even if we tried to explain what does this mean, but it was difficult. It was not very easy. So this is one of the methods, and you can get easily for like 0.5. Suppose someone is saying, and another problem of this scale is that few people actually want to rank 0 or 100, like, or 95. They don't want to say that, oh, I'm 95%. And I have also seen that someone has, even if they're not good, they said 95%, which means that they're really probably not understanding the scale well. So that's one of the challenges, but this is the most straightforward scale to get a utility or a value, utility score. Like if it is 50, then 0.5, 60, 0.6, 62, 0.62, something like that. It's very easy to get. There are two other methods, where time trade method, standard gamble. I will go to this and explain what this means. Here in time trade, the first one, we give the study participants two choices. One is, suppose you will live 10 years with diabetes, and first we say 7 years with full health. Then we say 8 years with full health, 9 years with full health, 2 years with full health. We give them a lot of options. And we want to see where they are saying, no, I want to live here in this example, 8 years with full health versus 10 years with diabetes. That means I want to sacrifice 2 years of my life, healthy life, if I have diabetes. So 10 years with diabetes is equivalent to here, like I'm rating this way. Many other persons will rate other ways, right? So you are asking your study participants, you are giving them a lot of options. Your options for healthy life is changing. You are saying, that means you are trying to see how many life years they want to sacrifice for having like 10 years of living with diabetes. So basically, this is how it should be. And in this example, the person said, I am happy to live 8 years without diabetes, like without anything. I want to live 8 years in full health as compared to 10 years with diabetes. I don't want to live 10 years with diabetes. I want to live 8 years in full health. This is one person's response. And here, so the utility value, here it is crossing at 10. So it is 0.8 because 8 years, actually 8 divided by 10 is the formula. 7 divided by 10, if it was like 7 years, it would have been 7 divided by 10. So that's how you get it. As you can see, this is very complex. And also, I believe, I never use this, but I believe this is what very stressful for the participants also to think how many years I will sacrifice for having, a disease versus a full wealth. It's not very easy to do. The second one, the standard gamble, is even more complex. You have a certainty scale, like certain health state, but then you are giving them options that you may die with this percentage chance and you may live a full health with this percentage chance. Now choose between these two. These are unethical, putting stress on people, but there are many researchers who used it, but these are not very easy way to do this. And it is actually asking them directly to say, how are you rating? What is the utility you are putting for your value? The most, I'm sure many of you know, the most used tool for estimating QALY is the EQ5D. Initially, it was EQ5D 3L. Now, most researchers actually use EQ5D 5L. Why 5D? 5 dimensions. See, it has 5 dimensions, which is mobility, self-care, usual activity, pain, discomfort, anxiety, depression. So 5 different dimensions. And these are very simple questions used in many countries, though initially it was actually done by a Eurocall organization called Eurocall, but it has been used extensively across the globe by researchers. It has even in India, it has been tested, it is available. The questionnaire is available in many languages, So when I did my study, I got it in Hindi, Tamil, and Marathi. So based on my requirement. So you just need to register. There is no money to get this tool, but you have to register because you have to tell them, the Eurocall, that why are you using this tool? It's easy. It's nothing difficult. It has 5 different dimensions and 5 different levels, as you can see. The levels are, I have no problem, I have a slight problem, I have moderate problem, I have severe problem, I am unable to do this. So these are 5 levels. That's why it is called 5D, 5L, 5 dimension, 5 level. And marking is very easy. You ask the person that, do you have, how will you say that your mobility level today? Do you have any problems? Do you have a slight problem? Do you have moderate problem? How are you feeling today? But it's all about today, okay? The day you are asking. And then there will be one tick here, one tick here, one tick here. If the tick is no problem, the marking will be 1. Like the number will be 1. If it is the second, like slight problem, it will be 2. Moderate problem will be 3. Severe will be 4. Unable will be 5. That's how you get a score for everyone for all 5 dimensions and all 5 levels, right? You get a score for people. Then there is a value set. So very fortunately, because of the team worked in PGI Chandigarh, we have a value set for India. So, like as I say, 1, 1, 1, 1, 1. Did you understand what does it mean? It means that that person answered no problem to all of these. All 5 dimensions, they said no problem, no problem, no problem. That's why the health state came 1, 1, 1, 1, 1. And the utility is 1. What does it mean? I'm perfectly okay. Right? Because I have no problem. I said no problem to all 5 dimensions. If I say something different, suppose here, 1, 1, 1, 2, 2. Look at 1, 2, 3, 4, 5, 6, 7. Number 7 row here. 1, 1, 1, 2, 2. What does it mean? I said I have no problem in mobility, no problem in self-care, no problem in usual activity, but I have slight problem in pain and discomfort. I have slightly anxious and depressed. So that's where. And then the utility score changed. It became 932. That means I'm not in perfect health. I have something to worry about. Okay. So this is how it is. You can easily administer this scale. I did not find any difficulty in administering this scale. And with this utility level, the formula will be utility level and how many years the person is in this state. Suppose in my last example, how long the person was with TB was in that health state, 1 year. You remember the person I wrote, the person with TB was suffering from 1 year. So that means in the health state, person was for 1 year. And if the person said that I have 11134, that's how he or she rated, then 711 multiplied by 1. How long is the person in that state multiplied by the weight? And weight utility score, you will get it from here. If the countries like Bangladesh or Indonesia does not have this score, generally you can use from other countries, but it's better to have the country score. Always it is better. So you will get the utility score like this. And as you can see, if someone says 55555, that means in all 5 directions, the person is saying I'm extremely bad, which is minus 923, which means absolutely towards death. You know, it's minus and below 0 and towards like very bad situation. That means the person is saying that my condition is terribly, like person is saying that the condition, quality of the life of the person is terrible. And this person, this 11111 person is saying that I'm perfectly fine. I hope you got it. And then, so I have an exercise, and that's the last exercise for you. Suppose an individual had been in cancer for 6 years. So the person is in the, I'm simplifying for you, that the person is in that health state for 6 years. And her responses to EQ5D 5L questionnaire was as follows. Mobility, no problem. Self-care, no problem. Usual activity, no problem. Pain and discomfort, slight. Anxiety, depression, extremely anxious and depressed. What are the utility scores? And how many QALYs are associated with this? So, no problem, no problem, no problem. Slight is second, moderate is third, severe is 4, absolutely, extremely is 5. Okay, no problem is 1, slight is 2, moderate is 3, severe is 4, extreme is 5. These were the utility score. And I said the mobility, should we also put this in the chat? But I don't know how to put this in chat. Sorry.
I'll put it.
Okay, okay. So my question is, how are you going to rank this? And what is the utility score from here? Utility score is from here. You identify the utility score and then calculate the QALY. Good. I got a response for utility score. Okay. If you have any question, feel free to ask, please. So yeah, so those who have answered the utility score, tell me how many QALYs are associated with this health state. The person is in health state for 6 years. It will be multiplied by the score. I told you the answer actually. Anyway. The individual had been with cancer for 6 years. Okay, I'm getting some, yes, some results. Okay. So I hope you understood this, how to do this. So you administer EQ5D5L and then you get response. For each individual, you were getting some response. I'm giving you the example of one individual who actually responded this way. Mobility, no problem. Self-care, no problem. Usual activities, no problem. Pain, discomfort, slight problem. Anxiety, depression, extreme. I asked, what is the utility score? So let's go back to the answer. No problem is 1, always no problem 1. Slight problem 2, anxiety, depression 5. So that means 11125 is the score how I got from EQ5D5L. If you go back to this, 11125 is associated with the score 702, right? So if you have this table, and if you administer EQ5D5L, you easily get what is the utility score. You don't need to do anything. Only you have to administer EQ5D5L to your participants. So you got this. 6 years in the health state. So QALY is basically 6 years. How many years in the health state multiplied by that? So the QALY for this person is 4.212. Similarly, you can do it for all participants. You will get whole lot of QALY, sum those up. So those many QALYs were associated with that health state. Now, if you can improve those QALYs through your intervention, then without the intervention, how many QALYs were there? With the intervention, so that means before you do EQ5D5L, you know how people will respond, and then do after intervention, you do another EQ5D5L, you see the changes of QALYs. Relatively easy, right? So you do the intervention, the baseline, you do something, and then you can follow them up. In many studies, they followed like they do EQ5D in 3 months, 6 months, 12 months. So, but it's up to you how long you think you want to see the change in quality of life through your intervention. So you do this and you take a baseline figure, EQ5D5L, and then you calculate the QALY, and then you do it again after the intervention, you calculate the QALY and see the change. That's how it is. And so thank you for your attention. That's all